Hello, everybody. Andrea Majewski here with Dentalelle. So let's talk about things you should not say to your dental hygienist, okay? If you say them, that's okay, but just know what I'm thinking inside my head, okay? So the number one thing is do not say, I hate coming here. I'm not happy. Hurry up. Just get it over with, okay? I have a lot of patients that when I used to work in a dental office anyway, not now that I have my own practice, which is nice because I feel that they contact me because they want me to be there. But when I used to work in a dental office, that's what patients would say. And I would kind of say to them like, oh, okay, well, nice to meet you too. Well, you're in for a teeth cleaning today, but you make it sound like you don't really want one done. So I don't know. Do you want to rebook your appointment? Like what am I supposed to say to that? So don't say that to your poor dental hygienist, okay? We know that you're not the most excited to be there, but saying things like you pretty much hate us and you can't wait for us to be done just kind of sets the mood for the whole appointment, right? Because then I'm kind of thinking, oh, I don't want to bother this person. I'm not going to say much. I don't know what to do. So yeah, just don't say that to your poor dental hygienist. Another thing is when we tell you that you have a lot of plaque, a lot of tartar, and we might say to you, the gums are starting to bleed a lot. Don't say to us, well, they're bleeding because you're cleaning them. They never bleed at home. If that's what you're saying, just so you know, they're not bleeding because we're cleaning them. Healthy gums do not bleed, okay? They don't. If we're checking the gum measurements, if we're cleaning the teeth and the gums are bleeding, that's just not healthy. We don't blame you or, we're not mad at you for, not taking the best care of your teeth, but we do have to let you know because the worst thing is we don't want to clean your teeth and then you sit up afterwards and say, well, how did I do? Like you didn't say anything. Do I need to improve things? You don't want to walk out of your dental hygiene appointment not knowing what we did, right? So that's why we do talk about like plaque levels, tartar levels, stain, and if the gums are bleeding, because we want you to know that you might have to focus a little bit more on those areas. So whether you're a dental professional watching this, you're probably laughing, right? Or a patient, you're probably thinking, oh, shoot, I do say that. And that's okay, you guys. You can say that. But just so you know, these are the truths, okay? There's things that aren't true and there's truths. Another thing is, which I hear a lot, is your child or your baby took all of your calcium from your teeth. That's why you have bad teeth. Your baby does not take your calcium, okay? Yes, you're contributing a lot more, obviously, when you're pregnant because you're eating for two. There's a lot of things happening. But your baby's not stealing your calcium from your teeth, okay? You could actually have more gingivitis when you're pregnant because there's a lot of hormones happening in there. That is normal. Not everybody gets that, but if you do, that's called pregnancy gingivitis, and you should be having your teeth cleaned every 3 months to keep things as healthy as possible, okay? But it's not because you are not getting bad teeth or bad gums from your baby, okay? Just so you know, it's just not happening. What else should you, well, maybe not so much like what not to say to your dental hygienist, but just kind of telling you guys like what's true and what's not true. Another thing what not to say is if we find a popcorn kernel stuck underneath the gums or something under there, and we say to you, oh, there's a popcorn kernel under here. And then you say, oh, that's weird. I had popcorn like 2 months ago. It's not a good thing. That means you probably weren't able to pick up the floss and get it out of there, right? You can still tell us, you're just being honest, but just so you know, okay? We're not excited to hear you say, oh, I had popcorn like 2 months ago. It's pretty funny. Another thing that I hear a lot of patients say is, I might tell them that they have more stain, more plaque than usual, so I might ask them what has changed. A lot of patients tell me, oh, we went camping for 2 weeks, or we went on holidays for 2 weeks. I forgot a toothbrush, so I didn't use one. Why don't you guys just buy another toothbrush? They're not expensive. That's the worst thing to say, because in 2 weeks, a lot can happen. They probably have a gingivitis. So don't tell your dental hygienist that you went camping and didn't bring a toothbrush and didn't buy one, or you went on vacation, forgot a toothbrush, and just didn't buy one. Sorry, I have pen on my arm. I saw patients today and I just kind of realized that. Sorry. But yeah, that's pretty funny, right? When somebody admits to not brushing for 2 weeks, I can't imagine. And another thing that I hear a lot is when I ask, oh, well, how many times do you brush? How many times do you floss? And they tell me, oh, I flossed the last time I saw you for about a week and then I stopped. That's okay, but if you're not going to floss, tell us, because there's different things that you might want to try at home to, you're not flossing, but it can still help, such as the water pick. The water pick's amazing to get in between the teeth. And I was reading an article the other day that says that the water pick's actually better than using the floss, probably because patients, people, whoever, are more compliant in using it. So if you're not going to floss, tell us. So that's just kind of something that you should let us know. Don't be ashamed, but don't act like you're going to floss. And then when we see you next time and things don't look so good, we wonder why. And then you say, yeah, I haven't flossed at all. Everything you talked to me about last time, I didn't even listen to it. It's not happening. Okay, don't tell us that. Another thing is not really something that patients say that I guess you shouldn't say, but what we kind of find annoying is when we're talking to you about your oral health and you say, well, does my insurance cover that? Well, I don't know if my insurance covers it, so I don't know. My insurance doesn't cover that, so it's just not happening. Please keep in mind that insurance is there, which is amazing, but we're not going to treat based on what your insurance covers. Not everybody has 100% coverage, right? We tell you what needs to be done for your oral health. We don't even look, I personally don't pay too much attention to insurance until afterwards. I will tell you what options you have. Like, for example, if I see you and there's a lot of plaque, a lot of stain, it's been 10 years since your last cleaning, I might say to you, well, I couldn't do the whole cleaning today. We're going to have to bring you back to finish. And then after it's done, the gums are in bad shape because you have severe gingivitis. I want to see you every 3 months. And if the first words out of your mouth are, well, insurance doesn't cover that, I don't want it, then kind of all of that oral hygiene instruction that I was talking to you about, or whoever, kind of goes out the window. So we feel like, oh shoot, like you're not really listening to what we're saying. I totally understand that you don't have unlimited funds, but don't be so insurance based, okay? Because your mouth, your teeth, you only have one set, you guys, one set. You don't want to be like, well, taking out all my teeth is cheaper than having cleanings for the rest of my life, so why don't I do that? No, don't do, no. Insurance, yes, they might cover teeth to be taken out, but that's not the best course of action, and you will be sorry, and we can't just put them back in there, okay? So try to look at insurance as being a good thing. You do have that extra. But whatever insurance doesn't cover, well, that's just part of you staying healthy. You know what I mean? If that makes sense. So that's something that I like to talk to patients a lot about too. And another thing I hear patients say is, yeah, I didn't really like the last hygienist. She was too rough, or she was not rough enough. We all stick together. I mean, we might not all love one another, but we're not going to talk bad about another dental professional, and you really shouldn't either, because what do you expect us to say? Do you expect us to say, yeah, she is horrible, right? Or he? No, we're not going to say that. So the things patients tell us, it's kind of like, okay, so the last hygienist was too rough, so are you telling me that I'm not allowed to get a good cleaning in there? Or the last hygienist was too gentle, so you want me to hurt you? What are you trying to say here? So, the darndest things, I guess, that patients say. So if you're a patient watching this, hopefully this made you laugh. And if you're a dental professional watching this, hopefully this made you laugh too. And if you can think of anything else, just comment. I would love to hear it, okay? And thank you guys so much. Please make sure to click like so that way I know people are watching. Let me know if there's a video topic that you guys want me to talk about. Thank you so much, and I'll see you in the next one.